Before we begin, a quick note. The information shared today is for educational purposes only and is not medical advice. Please consult a licensed medical professional for any health concerns. And now let me introduce our guest speaker, Dr. Howard Hindin. Dr. Hindin is a general dentist with advanced training in craniofacial pain and dental sleep medicine, a recognized pioneer in the integration of dentistry and whole body health. He was among the first dentists to remove mercury from his practice, emphasizing a biologically informed approach to care. A passionate advocate for collaborative care, Dr. Hindin has authored and presented influential position papers to both dental and medical communities nationwide. Dr. Hindin serves on Sharp Against Board of Directors, our medical advisory board, and is the co-author of GASP, the Hidden Airway Problem. Welcome, Dr. Hindin. Thank you for joining with us today.
Okay, I'm not used to doing webinars in the middle of the day, so this is nice. It's laid out, well, sort of. So what I thought I would do is I was going to talk about dentistry and how it relates, but I think I want to share my story about two perspectives. One is as a practitioner and one as a patient, because I'm both. In fact, all practitioners are both patients. And the desire to be better, desire to be healthy, have a better brain, and how life gets in the way and what we could possibly do. So what I'm going to ask you to do, I'm going to ask questions. I want this to be interactive. I might ask you questions during this next hour, and type your answers in the chat box, so so we can all be sharing the information together. We did that one. This is me. Okay. So, as I said, I am both a practitioner and a patient. And as a practitioner, I've been a dentist for the end of this year. It'll be 60 years I've been a dentist, which is pretty amazing. Ah, there's my friend Diane. I'll let her in. And as any young dentist out of school, what are they interested in is I want to be successful. I want to make a living. I want to build a successful practice. I want to really do excellent care. One of the problems dentists have is they want to be perfect, and dentistry is so imperfect. But I always had this inner curiosity as to why I'm doing certain things. But as I said, that was 60 years ago. And so in 60 years ago, that was like 1966. Dentistry was all about focusing on the health of the teeth and seeing what was wrong and then fixing it by doing things like fillings, crowns, implants, and extractions. It was basically repair. You know, that if you think about it, most of the specialties in medicine end in ology, which is the study of. Dentistry ends in RY, like masonry or carpentry. It's more like a trade. While medicine was the science and art of dealing with the maintenance of health and prevention, alleviation, and cure of disease, which is really what dentistry should be. So over the years, I either founded or was part of several organizations. One was the Foundation for the Advancement of Medicine back in the 1980s, which was a sort of a holistic practitioner patient group that looked to protect the patients and the doctors doing what is now called functional medicine. It was involved with like Dr. Atkins and Dr. Schachter and Dr. Hoffman. In fact, one of our board members, Diane Dzinski, is on this call today. I also founded the National Dental Acupuncture Society, and about 15 years ago, the American Academy of Physiological Medicine and Dentistry. And I was instrumental. I was invited to be at the beginning of Sharp Again Naturally, an incredible, fantastic organization, and that I love. And so 1966, one of the things I came across was when you're in school, half of what you're taught will be found to be not true in 10 years, but you don't know which half that's going to be. And I think it's probably much more than than 50% when I think back of that. So now we're here we are in 2025. So what's changed in dentistry? The use of fluoride is being thought about, being considered. I haven't used fluoride since 1970. Um, I have been instrumental in speaking at legislature for in order to eliminate the use of fluoride. Why? Because um, cavities are purely a disease of sugar. If there's no sugar, there's not going to be any caries. If your mouth is alkaline and not acid, you won't get decay. So much of medicine has to do with interventions that could prevent something as opposed to how we change who we are in our lifestyle in order to prevent something. Um, as Carol said, I haven't used mercury in my practice since 1970. And looking at all the other toxicities, there's a lot of toxic materials that dentists use, like nickel, chrome, mixtures of different metals, some of the plastics, and that's really changed. When I graduated from dental school, I would say that 90% of all fillings were mercury. Now there's probably less than 10%. Uh, so that's been a big change in 60 years. The other things that have changed is looking at periodontal disease is not just a disease of the mouth, but how, unlike what they say, what happens in Las Vegas stays in Las Vegas. It's not what happens what's in the mouth. What happens in the mouth can affect things in all parts of the body. Although they did have, like even 100 years ago, the idea of a focal infection, that something happens, the mouth can affect the rest of the body. But now, more and more, we're finding out that chronic disease of the mouth can affect the arteries, the heart, the brain, other parts of the bodies. We'll talk more about that later. And then how your mouth is shaped, whether you're missing teeth, uh, whether your arch is narrow, can affect how you breathe, how you sleep, and the function of your airway. And then also there's new information that even one missing tooth can have an effect on your health and even brain function. And then also the mouth can help your balance with your posture and gait. Did I skip something? Okay. And so practice has evolved where I'm looking beyond repair to finding the cause. What's the medical dental connection? I would say most of our referrals to our practice come from physicians and other healthcare practitioners. And I'm looking at the physical therapy dental connection, how posture and gait is affected by your bite. And also we look at nutrition, inflammation, airway, sleep, and breathing. Our office completed the Bredesen training, so we're certified Bredesen practitioners. And we also look at things like toxicity, stress, mindfulness, and uh, and incorporate things like acupuncture and homeopathy. So this is a patient. It's not twins. It's the same patient. The patient was referred to me because she had some sort of an autoimmune disease, and the thought was maybe if a mercury was removed, it would help her. She went from she had a virus. She developed something called myositis, where she came in walking with two canes. And so I looked at her and I said, I think that maybe your problem is more of an airway sleep problem, draw position problem. So I said, let me treat you for that. And if it doesn't work, we'll just remove your amalgam. So on the left, she's going to walk down the hall. And on the left It's before I alter the jaw position on the right is after. So watch. If I can get this to play, that would be good. Yeah. So watch on the left. She's wobbling a little bit more. She's sort of leaning for the wall. Her balance isn't good. And now she watch when she comes back. So all we did was we put a jaw in a better position where a jaw was in proper alignment, because the message we get from our eyes, our ears, our hands, our feet on the ground, and the position of our jaw tells us where we are in the world. And when one of these senses isn't working properly, we either overuse one of the other senses, or we begin to have poor posture and gait. You know, how many of us can stand equally well on one foot? One of the things we check for, can you stand well on one foot? You should be able to have the same comfortable feeling standing on one foot, right or left, with your eyes open or closed. So this is sort of like history as a practitioner, but I'm also a patient, and I've always tried to live a clean, healthy life. Had good dental care, obviously, good nutrition. My mother was a big advocate of somebody called Carlton Fredericks, who some of you who are older may or may not remember him. He was a radio nutritionist and he later became my patient. Um, Exercise regularly. In fact, I have a stationary bike in my office that's attached to an oxygen generating machine, which I've had for about 10 years, which now Dale Bredesen advocates for patients in order to get good oxygen every day. I have meditated every day. Basically, have hardly missed a day since 1973, and I am surrounded by wonderful friends and family. All things that I think are good. That doesn't mean I'm without problems. So at 84, and I feel I'm good at 84. I had AFib, which is an irregular heartbeat, for about 25 years. Surprisingly enough, I had coronary artery disease where I had 5 stents placed in last December, and I have pulmonary vein stenosis as part of a medical complication, and I have many allergies. So, first question, answer in the chat box. How many of you have more than one doctor? And you can just type your answer in the chat box while I'm doing these slides. And the second question is, do all your doctors talk to each other? Do they know, do all your doctors know what each other knows? And uh, and have you told your doctors the same story when you go to see them? So so how does all this knowledge help me? What have I learned as a patient? What have I learned as a practitioner? And so I'm going to share some of that more with you. So our organization, AAPMD, runs a great conference called Collaboration Cures. And Collaboration Cures says that no one discipline or practitioner has all the answers to problems, and we all have to work together in order to get the best result. So in 2023, Dale Bredesen, who you probably heard of, especially from this group, was one of our keynote presenters. I said to I said to Dale, if we got a group of 10 doctors together and we all went through the program together, can we get some sort of, can we do it as a group? And so he said, yeah, that would be great. It would be a great, because then you get a better idea of what the program is like. So got a sign up list. When we get 10 people to sign up, I got 24 people sign up. So we all completed cognitive testing. We all did very extensive blood work. Dale Bredesen went over all our histories and our blood work together, and we had individual programs made up for each one of us, and we met as a group every 2 weeks for coaching centers sessions. So, next question: what do you think was the finding? There was one finding in, of all 24 of us. We had one finding that was a little bit off. So if you think you know the answer, and even if you want to guess, because that's the way we learn by sharing information. I'm not going to tell you right away. And the second question is, of the 24 people, how many do you think of the 24 actually completed the program? And you could that's the next question. Put it in the chat box. I can't see the chat box, so Elizabeth, you're the only person I can see. So what do you think the answer is?
People
many-
that said 16, 8, 16, 8, 20.
Yeah, out of 24 people, how many people actually completed the program um, uh, fully, as a compared to like participated but didn't complete it?
Lisa was the most optimistic with 20.
And what would you say?
What would I say? You already told me the answer, so I can't say.
It was 8. It was 8. It was 8 who really did everything and completed, and maybe 12 to 16 who did something. And so this sort of blew my mind, because they said, so here we are, we're practitioners, we know this stuff. This is our passion, functional medicine, dentistry, believe in all these things. And when we all started the program, we went through the program, we did the testing, we did the lab testing, we spent $1,500, $2,000 on all the testing. So there's an initial commitment. What happened? How did that happen? So in looking back, what worked, having group support was really great. And most of us are like type A personalities. We sort of compete. We want to, if somebody's doing well, we sort of want to do better. And after a number of sessions, we got more comfortable sharing our successes and failures, and accepted ourselves as being human, sharing what went right and what went wrong, and not wanting to let the group down. One of the dentists, really good friend of mine from Georgia, showed up for the sessions but never did any of the work. He really didn't change his diet, but he was apologetic every session. But during that time, he had 2 children who died of suicide, and his wife had cancer, and he had other issues. And we said, you showed up. That's a success. You can always go back and do later. He didn't even have to show up. He could have not done that. So we have to decide what is a success, and what were the obstacles. It was time. We scheduled all our coaching sessions out for 6 months. It was 6 months of coaching, and it were on everybody's schedule. And there were some people who were never able to make the coaching session. They said, I'll watch the recording later. Something came up. I had something else to do. I have a very busy schedule. Something else is, and so somebody said everybody wants to have a healthier brain, but life gets in the way. Well, I watched the recording. So there was a commitment made of time doing the test, money, but life gets in the way. Time gets in the way. Um, our current friends and family could be an obstacle. When I was doing the program, I I was away in Florida for a couple of months, so it was great. I didn't have to go to the office, so I did very well. I was one of the 8, but also I was out of my current environment. I wasn't working. I was I could exercise every day, could make sure I got the right food, so it was sort of easy. My friends, when I came back to New York, my friends said, uh, "You look great. What are you doing?" I told them I'm on this medicine protocol. Everything is great. They said, um, "How did you change?" I said, "Well, no sugar, uh, no processed foods, no alcohol, uh, eating differently." They said, "Well, you're not going to be fun anymore. How long is this going to last? Because some people see you in a certain way, then they don't want to see you different. They assume that what you do is who you are. And so in making change, having a good support system is good. And then it's transitioning to a new lifestyle, because it's not about doing a program where you're going to do it for 6 months. It's got to be a life-changing program where you say, look, what I got away with 10 years, 15 years ago, I was lucky. And if I want to be healthy, I have to really change my life. And that's very hard, because, as I said, not only you changing your life, it's going to affect the people around you. And if you're somebody who's already beginning to suffer with dementia, you're going to need that support in order to make that change. And then getting the right information. Not having enough information can be an obstacle, but more so today, there's too much information. That you tell me what you want to eat, and I will tell you the diet that goes with what you want to eat. I think that would be a great service to offer people. And the other interesting things was that some people started gung ho on nutrition, others started on exercise, and people kept doing what was easiest for them. The things that were harder, they were sort of, I'm doing the nutrition, I'm going to get to the exercise. They haven't started that yet, because I think that's a common thing. They're in on part of the Apollo website, Bredesen Protocol, they have brain games you play in order to work on exercising that part of your brain that doesn't that needs more work. We all have a tendency to find a game that we do well on, and we keep playing that game. But the games we really should be playing, the ones that we don't do well on, but we don't want to come out of our comfort zone, so we keep playing those games. We cheat for holidays and special events. My grandchildren came over, wanted to make something that they'll enjoy. Well, they should be enjoying healthy food. So there are always excuses. It's amazing that almost the first 15 minutes where we talked about what happened to us in the week, it was always excuses. Uh, there were holidays. Uh, I went to a meeting, and I was away, and my spouse didn't get to do the right shopping, and so um, so how do we choose a path for ourselves in order to have a healthy brain? I don't know. Uh, what the age group we have here, but that when you start, it's never too early to start. I found this great quote from Desmond Tutu. There comes a point when we have to just start pulling people out of the river. We need to go upstream and find out why they've been falling in. So I spoke to one of our board members, Dave McCartney, who's a sleep physician, but he also is a cartoonist. So I said, can you make that into a cartoon? So we made this into a cartoon that we've been using for a long time. Think about the care that you get. Are you being treated for a downstream problem or an upstream problem? Do you know what the source of your problem is? Do you have healthcare practitioners who are helping you find the source of the problem or listening to your presenting symptoms and treating that? The other thing that I think is really important is to protect your feelings and respect your feelings. A good friend of mine, Dorothy Mullen, who started the suppers program in New Jersey, said, how you feel is data. If you eat a certain food and you feel a certain way, or you feel tired, or you feel more aches and pains, that's data. And if you if you don't have a practitioner who has the time to listen to how you're feeling and understand its importance, at the very least, you should have a journal and write this stuff down. You need to start early. That we're now finding that changes in children, poor diet, poor sleep, set the stages for chronic disease and Alzheimer's decades later. So it's never too early to start, but it's never too late to start. And then find the care and support you need, not that your friend has said, find the care and support best for you. And always review your successes. We always tend to focus and remember how we didn't do well, how we cheated on a diet, how things happen, and we diminish our successes and we accentuate our failures. Any change you're making, change is so difficult. You don't know how difficult it is. And anything that you can make, you want to review your success and build on your success. So one of the issues I was going through, I started to tell you before, I had 5 stents placed in December. And this was after I went through the Bredesen program. I'm doing well. Energy is good, riding my bicycle, and all of a sudden, I'm tired. My oxygen saturation is low because I measure it. And I went to my cardiologist, one of my ologists of 20 years, and he said, Howie, you're 84. You do more than most people. What are you complaining about? I said, something's not right. I said, I just don't feel right. I went to my gastroenterologist, another ologist, and I was complaining about some reflux, and he gave me some medication for the reflux. And I said, I have never, ever had GI problems in my life. And the medication you're giving me isn't working. He said, let's try something different. Let's change something different. I went to my pulmonologist, and as I said before, as a result of my treatment for AFib 25 years ago, I ended up with pulmonary vein stenosis because my pulmonary veins got scarred. So I have some respiratory issues. So he said, everything looks okay. You know, maybe you had pneumonia or something. So these are my allergists not talking to each other. And these are all wonderful doctors. I respect them. I'm happy they provide me more care, but they only care for what's in their silo. And I said, what I'm missing was really a good quarterback. And so I got a referral to a functional cardiologist, quarterback, and he said, I don't think you have heart rate. And he put a nitroglycerin tablet. Nitroglycerin helps people with heart pain and angina under my tongue. And within seconds, 80 to 90% of my reflux issues went away. And so then we did some testing, and I had of the three major coronary arteries, one was 99% blocked, one was 91% blocked, and the other was 70% blocked. He said, "How come you walking around like that?" I said, "Well, nobody told me I'm not supposed to walk around, but probably only because I lived a very healthy life was I okay." And in doing some research, probably this was a genetic factor, that because my father had died of a heart attack at 70. So having good doctors is great, but having a quarterback is even better. We need a quarterback. I know I'm reasonably informed, and I'm not. And if I try to be my quarterback, I even miss the stuff. So, so my question to you is: do you have a good medical quarterback, or do you have several ologists who don't communicate in this day and age where everybody's doctors are so busy? They look at their computer screen while they see you. I said to each of them, I know I'm covered by Medicare. I will pay you. Tell me whatever you want. Spend a half hour together and discuss what you think about my case. You have a dentist. A lot of us have dentists we've seen for many years who really takes good care of you. Your mouth may be in good shape. You're not missing teeth. You have a good smile. But does your dentist look for the causes and the connection between what's going on in your body and in your mouth? Because there are a lot of connections between the two. So a couple of possibilities of what you can do is you can get a turnkey program. Say, I want to have a healthier brain. You can go to something like the Bredesen Apollo site. Happy to sign you up and go through the program like our group went through as an individual. Get a health coach there. But it is a great program, but they're fitting you into their program. As individual as they say it is, it's an individual program. And it's a business also, because they have products they want to sell, and supplements they want to sell, but that helps fund all the good work that he's doing. So that's one way you can do it. It's easy. Everything gets taken care of, and it's done. Another way is to pick your own team. Find functional medicine, dental doctors. Somebody has to manage it, put all the pieces together. And if you think about all the reversible causes, whether it's reversible causes that Chopping naturally talks about, or Bredesen's 38 holes in the roof, you need to have a complete evaluation before you start. As it's like that a week ago, there was an article in the New York Times, I know what everybody saw, about how the expensive Alzheimer's lifestyle plan offers false hope. That's what experts say. That was sort of a negative article on the Bredesen protocol and in Apollo Health. And if you want to copy this link, or I'll put it in the chat box, this is the answer to what was said. And they basically found one person who didn't do well and based the whole article on that. And and if you look at who is the author of this article, she's written other hit pieces on other organizations, but just write it down. I'll put it in the chat box. But you want to be able to read it and make your own decisions. If you want to build your own team, good practitioners are hard to find, and good practitioners are busy. And if they're not functional medicine doctors where they're fee for service or they're Medicare or insurance providers, it's a 6 to 8 minute exam and they're done. Even most functional medicine practice practitioners have protocols that they try to fit you into the protocol. And they often, some practices even sell supplement. so that you may not be getting the individual care that you need, because in some ways functional medicine doctors can be, instead of using traditional medications, pharmaceuticals, they're using supplements, and a lot of supplements. They don't really have a lot of time to spend on how to change your diet, how to purchase food, how to combine foods, and things like that. And then there's a third choice: get a health coach. So one of the things that I'm very big on is I think that health coaches are the wave of the future. Whether you choose any other program or you try to pick your own program, you need a guide, and practices are too busy to provide a guide. If you have a good health coach, you are the agenda. They have a good health coach has no other agenda but to find the best plan to you, help you prioritize the treatment. You're the center of the program, and it's capable of bringing all the pieces together. In the world today, there's a little bit of a problem because in doctors, even though they're successful, they're a little bit defensive. They're concerned that what if the health coach says something different than I told them. But that has to change, because if you believe that the treatment of Alzheimer's and dementia, as well as all chronic diseases, is really going to be based on a collaborative approach with multiple practitioners from different point of views and lifestyle changes, you can't go every 3 months and expect to really make the changes. You can go and get more supplements or more care, but you can't do it yourself. One of the reasons that I am still involved with CHOP again is I think that what they do, they provide the resources, but they don't even have a fraction of the health coaches that I think are needed in this country. I think that every practice that's treating any kind of brain health should have health coaches that they can refer to. And that's one of the things I'm trying to work on. I would like dental hygienists who clean your teeth to really become some sort of maybe entry-level health coaches, where they can recognize, screen for the problem, and then refer to somebody who can provide more advice. I know we're getting to correct questions and answers soon. This is my bonus piece, because this is my latest thing that I'm really involved in, mitochondria. I guarantee you're going to be reading more and more about mitochondria. Mitochondria, every cell has multiple mitochondria. They are, and if you click this QR code, it's a great article that was just published about how important mitochondria are. Mitochondria provide all the energy for the cell. It is an incredible thing, because not only does it provide the energy for one cell, it provides the energy for cells to work together. It provides the energy for one person to work together. So that if you have to, you're sitting in an airplane, you're getting up, plane lands, you're getting up to get your luggage out of the overhead, the mitochondria for those muscles that you would need for that particular task get turned on and begin to put out more energy, while the others you don't need don't do anything. They now show that they can realign, they can fuse together, they can separate, and they know what's going on not only in the body but outside the body. They know if the weather changes and you're cold, they have to generate more heat. And they communicate and they socialize. The way mitochondria work in our body is the way our society should work together instead of being divisive. And they're going to find that mitochondrial dysfunction a part of the beginning of every disease, going back to childhood. I think we'll go to questions. I'll stop my screen sharing so I can see what's going on in the world. Where are all the participants? Do we have pictures of the oh, I can put in the chat box, see what's going on here. Okay.
Um,
Okay. Who wants to talk? Questions?
I'll note that I will include the links and the QR codes from your presentation in my follow-up email to all registrants.
Mhm.
Susan asks, any practitioner in Westchester County? Not sure specifically, I'm guessing a holistic. Is that right, Susan?
Well, doesn't that Shop Again should have a list of practitioners.
I wish there were more of them. We know of a few.
I think the key is you got to interview a practitioner. I find it's amazing how people will listen to what a doctor says, but if they're buying an appliance or a car, they'll check it. They'll check background. They'll check everything. They'll check Carfax to see what the history is, and they don't do that. And not every if somebody says, I went to a great doctor, he's great, you should go to him, and you don't like him because it's different. You have to find out, will he answer your questions? I think the most important thing is that now that I've gotten older, and I said, I've learned so much. I know a lot of stuff. I probably forgotten a lot of stuff, but I know a lot of stuff. But that doesn't make people go ahead with treatment. It's understanding who that patient is, what their needs are, what their obstacles are, and what their challenges are. You know, that's the difficulty. And there aren't enough people because medicine has sort of branched out to short appointments. Everything gets typed into a screen. And if you want something different, you have to go to a concierge doctor who will charge you a lot of money. They could be $10,000-$20,000 a year, and that doesn't work for most people. That's without having a problem. If you have a problem, then they'll see you. But so medicine is a virgin, and there's a lack of time, and that's why I think health coach is so important, and because that fills a void. You know, that it was what my grandmother used to do. She was my health coach. I guess she would tell me what I needed.
Another question is, where is your dental practice? Are you accepting new patients? Or do you accept patients for specific issues who may already have a dentist?
Well, for me, you practice in Suffering, New York. It's SUFFER on it. It's not
I'll include the
SUFFER.
link to your website
Yeah, it's
as
not
well.
Suffering. It's Suffering, New Jersey. And yes, we accept new patients, and I have the good fortune to be in practice with my son and his wife, who are both very big advocates of this whole method of treatment. My son Jeff did a great study with Weill Cornell Medical Center on on Tourette's patients. All, you know how I showed you that video before, this woman walking down the hall, that making altering jaw positions for Tourette's patients actually reduce their tics better than any other treatment because it has to do with airway sleep and breathing. So yes, we accept new patients. I would like challenges. I need something to make me think, to keep my brain active. That's my brain game. New patients with a problem.
Another question, what are some holistic solutions to compensate for missing teeth?
Holistic. Well, if you're missing teeth, you probably have a half-listic mouth, and you need to replace. You need to replace them. Either, but you can be replaced with a denture, a partial, implants, a bridge, because um, every tooth fits into a socket. When you bite on that tooth, it's the pressure sends a signal to the fifth cranial nerve, which sends a signal to the brain, tells you where you are in space, tells you helps stimulate your brain. So when you're missing teeth, and I mean the key is not to miss any teeth. If your children, grandchildren have a problem, if the dentist orthodontist says we have to take out teeth to make them fit in the small mouth, go someplace else. I mean, that's you don't want to do that. It's not necessary. Uh, my co-author and Michael Gelb says if any orthodontist that takes out teeth should have their hands cut off. Yeah, but because when you think about it, our tongue fits in our mouth, and if the mouth is the house for our tongue. If the house is big, we have a lot of room for our tongue. And if it's small, our tongue can only fall back. It'll affect our airway and breathing. And you don't have a sleep problem maybe till you're 20, 30 years older. One of some kid I know who she's about 19 now. We saw her 15 years ago. We wanted to do expansion. Parents were in the midst of a divorce. They were fighting. And nobody would bring her. And now at 19, a face looks pushed in. She's on antidepressants, anxiety medication, and she has a sleep airway problem. And we it was there. It was recognizable, and that's what I find is the most upsetting. That these problems are there, not just for dental problems, but health problems, and it's predictable what kids are going to have problems, and so I don't know what, as I said, I don't know what age group we are all here, but I'm sure we have children and grandchildren. You want to protect them. You want to make sure they get the full and best care, and even if your children won't listen to you, you have to get past your children. Because even if you messed up your children, you get another shot with your grandchildren.
Someone else asks about extracting wisdom teeth with decay that are causing bone loss. Should those be extracted? Depends.
No,
Mm.
you got to get rid of the decay. If they're having bone loss, and they're the only teeth that have bone loss, there must be some problem cleaning back there. So they're not giving you anything. Wisdom teeth, you can live without wisdom teeth. Again, we talked about why you get decay in the first place. Is the mouth alkaline? There's a new mouthwash that I'm trying out. The company, it's made from phytocannabinoids, which are the parts of the hemp plant that are not the THC or CBD, but they're incredible antioxidants. So what it does is it kills the bad bacteria, but doesn't harm the good bacteria. Most of the mouthwashes we use are just kill bacteria, like the chlorhexidine or the or all the mouthwashes, Cepacol, things like that. So it adds promise. It also has um, silver in it and other things, so it balances the pH, which is good. So there are things coming out in the market. We're beginning to look at how do we restore balance as opposed to how do we teach the problem, which is going to create a different imbalance that we have to correct. Alzheimer's and dementia is sort of the end result of decades of imbalances. They call it type 3 diabetes. The one common symptom that finally we all had, all 24 of us had, was increased insulin resistance. So increased insulin resistance is the first sign of a carbohydrate metabolism problem. Before your HbA1c goes up, before your glucose level goes up, and it's a test that most doctors don't do, but it should be included in tests because if that's the time you want to take action when you already see that you're having trouble balancing the glucose insulin by not and your body's building up more resistance to insulin.
What is the name of the mouthwash you mentioned?
It's called Pear, Pare. I will
Can you
I will
start?
send it to you and you can put it in the website. Yeah, I mean we've been using it on some of our patients who have some retractable gum problems and it seems to be working because they said I said, would you help us promote it? I said, well, let me try it. If it works, then we'll see how that works because, I think Lisa and I have spoken. Dental hygienists who clean teeth. You don't. If people clean their teeth right, they don't need to have their teeth cleaned. Nobody spends more time with a patient in the course of a year than a hygienist. They spend up an hour and a half to 2 hours twice a year visits. They have an incredible opportunity to discuss all these things like sleep, nutrition. Um, if we look at, we always look at blood work and what diseases people have. If you're taking certain medication, it's almost indicative that there's some sort of sleep, airway problem or something going on that can be treated. But if you're only treating the symptoms, it will get worse. And then another disease will pop out. That'll be treated. Another disease will pop out with all the same imbalances. And we have to get back to the root causes of the problem.
And the name of it, the insulin resistance test.
It's called insulin resistance test.
Yeah, that's what I thought.
Yeah.
Oh, Parla.
Yeah. I think that a good webinar might be the progression of how we go from insulin resistance to diabetes to chronic, so you look at insulin resistance. You have poor oral hygiene. We look at the microscope, what bacteria in the mouth. If you have some of the bacteria, it's the same bacteria that you see in arteries of disease and in brain of plaque. So those are issues. I read an interesting article about kids with Down syndromes are very prone to dementia. Do you know why that is? Because they have one of their genes is missing that allows amyloid plaque to build up a lot quicker. So almost every Downs kid who lives to be 40 has high levels of amyloid plaque, and almost 50% of them will have some form of dementia by the age 40 or 50. So there are so many factors to be considered. So there might be other genetic or protein making things that could be factors. And so none of us are really smart enough to track down everything. We need a team. We need good support. We need to say, I'm feeling better, but okay, what's the next step? Because there always is going to be a next step.
And that mouthwash is a tablet?
No, it's a rinse.
Okay.
Talk while I go.
Is it PARLA?
I was looking for it also.
One of their products is, it's, company is called Dental.
Okay.
I'll take it. And, or, so you click on Fido Dental and I'll tell you more about it. And they have research they want to do. David Cooper, who's the founder, is an MD PhD from Hopkins and Duke, I believe. And he's a real, like, he just keeps doing research. So we're trying to get a research project in different dental offices. What happens? People doing the same home care, but just using a different product. How much is the product? Because sometimes if you introduce a new product, people do clean their teeth better, and it might be the technique rather than the product. So it's new. I think it has potential. So I'm not saying it's the be all and end all.
VITO?
Fido,
Oh, yeah,
P.
PHYTO.
PHYTO Dental, DENTL.
So Howie, it says it's DENTICDS pair rinse,
Yeah. Yeah,
Dentic DSTM
yeah.
or PAIR rinse.
Yeah,
16 ounce.
they've changed the name of it a few times, but yeah.
Okay, I'll include this in the,
So we're looking at, if you use it, we take microscopic slides of what's in the mouth before and after. Does it change the pH? And I actually change it from the bad bacteria to the good bacteria. We measure the pH to see whether the pH is changing. And and then we see if other things like chronic inflammation, HA1C goes down, C-reactive protein, erythrocyte sedimentation rate, interleukin-6. So we're trying to see like what exactly happens, because it's nice to have healthy gums, you don't bleed, but are we changing how what's happening in the mouth is affecting the body? You know, that'll make a difference. You know, and then one of the other interesting things is, since we work with a lot of physicians, as we change things, they might not need the same amount of medication, blood pressure medication, but I'm not going to change somebody's blood pressure medication. So there has to be good communications. And one of the other things that I found is, if I see a patient, and I work with a great physical therapist, Brad Gilden. Patient comes in, tells me the history. I refer the patient to him, gets the history. We compare notes. It's not the same history. People tell us different things because maybe I'm older, I'm a father figure. Because patients want approval. They don't want they don't want anybody to think ill of them. So nobody ever discloses all the information all at once, like on a first date. And nobody ever discloses the same thing to all people. But it really makes it hard to treat the patient. You only treat the presentation that patient gives you. So one of the other things we're working on, you know, most hospitals have a my chart and thing. So that, wouldn't it be great if there was like a chart where all these separate practitioners can put it in, and then at the end of a visit, a patient can review it and say, this is the right information, because if somebody's trying to type and listen to you, they may type the wrong thing. And then, you know, it's sort of like in school, the worst threat, it's going to go on your permanent record, you know, and it's there. So, you know, these are life challenges that have nothing to do with all the wonderful things we can learn about mouthwashes and rinses. It's how people relate to each other.
Mhm.
And that's why I think you health coaches are so fabulous, because you take the time. I know Lisa well. She is one of the best listeners I know.
Thank you, Howard.
I know that if I say something, she's heard what I said.
Well, we're a little over time here. But
Have a patient with their mouth open, sitting, waiting for me.
I think it's been a fabulous presentation, Howie. Thank you.
thank
And
you
I
for-
will include the address and contact information for Howie's practice.
Anybody has any questions, they can just email me and I'll get to answer them.
Great. Okay, I'm going to stop recording.